my name is Christine Hein. I'm an emergency physician and also the Chief Wellness Officer here at Maine Medical Center. And I'm going to talk to you today about a tool for burnout prevention, which is the concept of self-valuation. It's widely recognized that physicians are subject to increased rates of burnout compared to our non-medical peers. And it's kind of ironic because many of us pursue a career in medicine with the intent to help others, help our community members maintain their good health and well-being. And at the same time, we are subject to an occupational hazard of increased rates of burnout and mental illness and challenges regarding our medical education, training, and professional careers. So for physicians, the professional norm and culture often makes it very difficult or unacceptable, frankly, to prioritize self-care and also have a self-compassionate view or response to perceived imperfections or errors that we may experience during the course of our careers. The demands on our time can crowd out, time for basic necessities such as sleep and hydration and eating. And we need to push back at this wherever possible in our daily experiences throughout the course of our careers. And one way to do this is to recognize it, identify it, and then develop skill sets and strategies for promoting self-care and also a compassionate response to ourselves when we're going through challenging times. We know that burnout has many negative consequences, both on patient outcomes as well as our own individual health and on our ability to experience professional fulfillment and joy, as well as on organizational safety and success. And it's also really important to recognize that approximately 80% of burnout is related to organizational factors, with only 20% or so being related to individual factors. So it is very important that organizations are also attending to burnout prevention and mitigation strategies while we are working on strategies to improve our individual resilience. The Stanford model of professional fulfillment kind of demonstrates this split with three different domains that contribute to professional fulfillment. The two denoted in red are meant to be organizationally driven factors of burnout or of professional fulfillment, and that's culture of wellness and efficiency of practice. And the area shaded in blue is meant to be an area that it can be individual responsibility. So I think it's really important to kind of pause and think about this for a moment, because physicians as a whole are a very highly resilient group, but that resilience can be compromised by our medical training and education, particularly with regards to the concept of self-valuation. So self-valuation has two components, and that is the intentional prioritization of our personal well-being or our self-care, and then also approaching perceived errors or imperfections with a growth mindset and as an opportunity for learning or improvement, as opposed to opportunities for self-flagellation. So the self-valuation scale is actually validated, and there's 4 components to it. It's measured on a 16-point scale with higher numbers being associated with higher rates of self-valuation. And so it looks at whether we are prioritizing care of our own health in the face of pretty significant time pressures, as well as whether how we are approaching the conflict between taking care of our own needs versus that of our patients. And then the growth mindset piece is looking at when we perceive that we have made a mistake, how do we talk to ourselves? What's our internal dialogue? Do we talk to ourselves like we would talk to others with self-encouragement, or is it a more negative internal dialogue? Are you extending that same compassion to yourself that you would to a colleague if they came to you to discuss a challenging event? This is really critically important because low self-valuation has been associated with many negative impacts. The first of which is that having lower self-valuation is associated with higher rates of burnout, as you can see from this graph. We also know that low self-evaluation is associated with the development of sleep-related impairments. And both of these concepts, burnout and sleep-related impairments, are really important because they're both associated with increased rates of perceived medical errors of clinical significance. So these were self-reported medical errors that the individuals felt had clinical significance. And you can see that with the presence of burnout, sleep-related impairment, or both, the rate of medical errors increased both in trainees and attendings. And perhaps most concerning of all is that lower self-valuation scores are associated with increased prevalence of suicidal ideation. So the way we talk to ourselves certainly has real impact, both for us and our patients. And if you look at this with relationship to some other occupational well-being variables, such as our impact on personal relationships and professional fulfillment, there is a significant correlation with both of those as well. Self-valuation has also been correlated strongly with depression and anxiety. So I think the take-home points here, if you're kind of thinking about this message and the concept of self-valuation, is that while we know that the majority of burnout is due to organizational factors, there are some elements within our control that we can work on that will have a real impact on our well-being and the care that we're able to provide for our patients. And this concept of self-valuation is one that is increasingly having research and more of a national dialogue occurring around it, because it is very strongly related to burnout, sleep impairment, depression, anxiety, professional fulfillment, and is one that we could actually start to work on for ourselves. We can push back against the culture of medicine that has taught us for decades that it is not okay to take time to care for yourself, and really understand how critically important it is to be the person that is there to care for yourself, as well as members of your community, your patients, and all of the responsibilities that we're balancing. So I really appreciate your time and attention today. And that is the end of this Just in 5. Thank you.